Good morning, everybody, and welcome to WPA's latest webinar, Sleep's Importance for Mental Health in the Workplace. My name is Mark Slynn. I'm going to be your host today. I'm WPA's Sales and Marketing Director. Just to get us warmed up, here's some frightening stats around the whole fatigue and sleep and performance link. Insomnia rates globally are thought to have doubled during the course of the pandemic. The RAND Institute for Europe estimates that sleep deprivation has cost the UK economy more than £30 billion a year in lost productivity costs, and a quarter of the cost of all workplace accidents and errors potentially are attributed to employee insomnia. So quite clearly, it's a hugely important factor, sleep, in how we both feel and perform. And we are incredibly lucky today to have Sophie Bostock with us. Sophie is a sleep scientist with a special interest in anxiety, mental health and fatigue, and she's going to guide us through this really complex but interesting topic. Good morning, Sophie.
My role is really to try and convince you today that there is a huge amount of evidence that we have a large opportunity as employers to help people improve their health, well-being and performance through supporting their sleep. Now, in order to convince an employer that sleep is important, I really wanted to try and get myself into your mindset. So according to a survey of over 1,400 US employers last year, there were 3 top key factors that were considered when it comes to benefits in the workplace. And the priorities for employers, apparently, are attracting and retaining talent, reducing costs, and promoting health and well-being. Now, this survey was amongst US employers, so I recognise that the case in the UK might be slightly different, but I suspect that this triad of trying to save money, trying to get the right people in the right jobs, working as productively and healthily and happily as possible is probably true for all of us. So what is the role of sleep within that? Well, we all know that sleep's important, and if I asked you to identify a sleep-deprived employee, you would probably be able to spot them pretty quickly. You know, we're very familiar with the idea that when we're sleep-deprived, we're tired, a bit irritable, forgetful, maybe concentrate a little bit less well. And I think on the surface, this doesn't look particularly serious. And even when we listen to those stats that Mark presented about the RAND study looking at lost productivity, if you try and put some figures on it, for those people who are sleeping fewer than the recommended 7 to 9 hours every night, they will lose in the region of 4 to 6 days in productivity a year. Now, if you tot it up and add it all up, yep, absolutely, that's a cost of sort of £30 billion a year to the UK economy. So it's pretty huge. But I think it's something that a lot of us will just kind of push to the back of our minds and say, yeah, well, we'll deal with that. We'll get our employees to catch up on weekends. I think that massively underestimates the importance of sleep for performance at work and the costs that it's having on your business. And to explain why, I really have got to delve into what happens in this sleep-deprived brain. So, in order to get your head around that, I want you to think yourself back 200,000 years ago or so to when humans were living camped out on the savannah. At that time, there was no Netflix, there was no social media, there were no client deadlines. What sort of things would have kept your brain awake at night? Hopefully, you're thinking some kind of threat, some kind of danger, predators, storms, hunger. Over hundreds of thousands of years, our brains have evolved to see sleep deprivation as to indicate that we are under threat. And as a result, the brain copes with this in a number of different ways. First of all, the amygdala, which is the switch which turns on our fight or flight stress response, becomes more sensitive. After one night with no sleep, your amygdala is 60% more sensitive to threat. So this means that the same situation that yesterday you would have coped with in your stride suddenly becomes overwhelming. Over time, if this continues, you end up being more vulnerable to emotional disorders, anxiety, depression, risk of burnout, because of this kind of faulty switch, this tendency to turn on that fight or flight stress response. At the same time, the brain has to prioritize where it's expending most of its energy. And if it's focused on the threat response, what actually happens is that it reduces the amount of activity, reduces the blood flow to this part of the brain, your prefrontal cortex. This is the part of your brain which is responsible for executive control. All the most important functions in the modern workplace, I would argue: information processing, recall, creativity, cognitive flexibility. The prefrontal cortex is also responsible for self-control, making you more prone to lapses, more prone to risk-taking. And if we try and put some sort of numbers on some of the health consequences of this overactive stress response and the inability to recover overnight, it's kind of like playing Russian roulette with your health, with a roulette wheel which is weighted against you. And in fact, if you think of any health condition, anything that you really don't want, cancer, dementia, diabetes, heart disease, stroke, I will pretty much guarantee you that there is evidence that either lack of sleep or irregular sleep patterns will amplify your risks of that condition. So just a couple of examples in terms of your susceptibility to viral infection. It's thought to be around 3 times higher for people who get fewer than 7 hours sleep. Your risk of dementia in your 50s and 60s is about 30% higher for those who get fewer than 6 hours sleep on a regular basis. And we know that for those people suffering from insomnia, their risk of developing future anxiety or depression is around about treble. So again, if we try and put kind of some numbers on it, typically studies will estimate that healthcare costs are around 60 to 70% higher than good sleepers. So when you think about the consequences of sleep loss, we might think about someone who looks tired, but I would argue that this is very much the tip of the iceberg where it comes to the consequences of sleep deprivation and irregular sleep patterns. So underneath that tired exterior, they're amplifying their risks. As Mark said, insomnia is thought to be responsible for around about 7% of the number of workplace accidents, but 24% of the cost of those accidents. And even risk of death, if you want to be really morbid about it. Those individuals sleeping for fewer than 6 hours a night are at 13% increased risk of mortality versus those sleeping for 7 to 9 hours. When it comes to cognitive function, you might see someone who finds it difficult to concentrate, but that disguises the fact that actually their ability to learn is very much impaired. If you think about the time and effort that your organization spends on learning and development opportunities, and then you think that actually somebody who hasn't had enough sleep, they could be anything up to 40% less likely to be able to recall that information. Other evidence looking at entrepreneurs making investment decisions which are impaired, they struggle to spot the really poor opportunities and may end up diverting resources towards kind of failed financial opportunities. Low creativity. This is a big one for the modern organization. It's very difficult to measure, but certainly laboratory studies have found that our cognitive flexibility, our ability to link ideas together, is very much impaired when we're short of sleep. And then potentially one of the most important impacts, we find it very difficult to detect these impacts on ourselves. We're pretty good at spotting sleep deprivation in other people, but not necessarily in ourselves. And again, to give you a kind of rule of comparison, it's been shown that people sleeping for 5 hours for 4 nights in a row perform in a very similar way to people who have a blood alcohol concentration which is over the drunk driving limit. That's just 4 nights with 5 hours of sleep. Now, you wouldn't tolerate someone who was drunk coming into work. And yet we often turn a blind eye to sleep deprivation. And finally, from a kind of emotional standpoint, we recognize irritability, but below the surface, this hides a vulnerability to anxiety. Studies have shown that sleep-deprived leaders have less charisma. They're also more prone to bullying behavior. We just have a shorter fuse. And this can also lead to contagious effects on sleep deprivation. Because imagine if your boss is a bit shirty, a bit sleep deprived, a bit irritable, a bit snappy, sends you emails at 10, 11 o'clock at night, what are you going to do? Well, you're going to get defensive. You're going to start feeling like you've got to respond and be ready at all times of day and night. And that stress kind of can further interfere with sleep and performance. There is a great review, by the way, if anybody's interested in the science underpinning all of this. Chris Barnes, who I've worked with before, wrote a review in 2019 called Why Healthy Sleep is Good for Business. And some of this evidence is more recent than that, but it's a really great place to start to find out more. So the consequences sound pretty serious, and the fact is that the scale of opportunity here to address some of these things is huge. We now know from studies in the wild which have used wearable devices that sleep deprivation is probably more rife than we thought it was. So this is a chart which combines data from 70,000 workers across 47 different countries, across 11 million nights. And it shows how much sleep people were typically getting during the working week. This is non-shift workers. And you can see here the line in blue for men and orange for women, how much sleep they were getting during the working week. And this green line here represents the minimum recommended amount of sleep. Most of us need between 7 and 9 hours. So that's the absolute minimum that people are needing. And what you can see quite clearly, men in particular are getting about half an hour less sleep than women, and at most age groups during the week, not getting enough. And how do we know they're not getting enough? Well, partly because they're trying to catch up at weekends. And unfortunately, as Mark also introduced in the introduction, this situation has been getting worse since COVID began. So pre-COVID, if you'd asked me what proportion of people suffer from poor sleep, I probably would have said, well, maybe 1 in 3 are having occasional sleep difficulties, but probably about 1 in 10 are experiencing insomnia. By that, I mean a chronic sleep problem, difficulty falling asleep, waking up in the middle of the night, or waking up feeling unrefreshed. But one study that came out recently, looking across the pandemic at different countries, found that around about 1 in 5 of the general population were experiencing insomnia, and these rates were much higher when we look at those professions which were particularly at risk, and of course patients. And we introduced this session by talking about the role of sleep in mental health. And as I've already said, disrupted sleep leads to disrupted emotional control. Now, it's not new news that poor sleep and poor mental health often go hand in hand. We've known for a long time that roughly 2/3 of those with anxiety and depression will also experience insomnia, and vice versa. But what has changed, and there has been a sea change in our understanding of the clinical science of sleep, is that insomnia is no longer treated as simply a symptom of those other disorders. It's actually a driver. It can be a cause of anxiety and depression. And since 2015, the advice has been to treat insomnia regardless of comorbid conditions. It is a disorder in its own right. It's not just simply a sign that something else is going on. So that was the first sea change. And then the second sea change is that because we know that these relationships are bidirectional, what we also know, and this is the good bit, is that if you address insomnia, you can also improve mental health. And there was a meta-analysis of 65 trials that came out in December, which showed pretty conclusively that if you address insomnia, you will also have improvements on these other areas of mental health disorders, including anxiety, depression, and a number of different conditions. So how are you going to do it as employers? What can you do to improve things? Well, this is just a selection of a few ideas from employers that I've worked with. This is a drop in the ocean. There are, of course, lots of people doing different things in this space. I'm very fond of a Venn diagram, so I've tried to group these interventions and ideas into 3 main areas: education and training, environment and culture, and clinical screening and support. So what do we mean by education and training? Well, for me, at its core, it's really understanding how sleep works. So this pattern of alertness that we have every day, what are the things that control the timing and quality of your sleep? So, for example, taking employees through circadian rhythms, the importance of routine, the roles of light, food, and exercise in controlling that. And then also sleep pressure. What is that? What does caffeine have to do with that? How can naps play a role in reducing fatigue? And also the stress balance. Why is it that stress disrupts sleep, and what can you do? What are the strategies that you can use to flip from a fight or flight mode into a rest and digest mode? And 2 years ago at a previous WPA event, I was kind of introducing these ideas. And in the audience were Gary and Kevin from Surrey and Sussex Police. And they said, well, look, we know we've got an issue with fatigue and poor sleep. We do an annual survey. So what can you do? What's the simplest thing that you could do to try and help our people to improve their sleep and improve well-being? So we designed a very simple intervention. It simply consisted of 2 webinars and a few kind of weekly emails, workbooks, and we did quite a lot of evaluation. So we got a lot of feedback as we went through so that we could try and tweak the program as we went forward. And what we found after 5 weeks was that actually 85% of those involved, and this was quite a small pilot of 60 people, had taken action to improve their sleep, and they were sleeping on average 30 minutes extra a night and reporting productivity gains. So this seemed quite promising, and this actually won Surrey and Sussex Police an award and then got picked up by the National Wellbeing Board. And when we looked at the evaluation, a lot of the things that people were taking away, these were not rocket science. This is really simple stuff, but no one had ever heard before the evidence behind why these habits, these behaviors are so important. So education, very simply, can make a difference. And this has since grown. It's morphed into a much bigger program, looking at all different aspects of sleep science, which is available now to all police, volunteers and staff all around the country. And we know that these things can make a difference. In, again, a meta-analysis of different studies, it was shown that these simple workforce education programs can not only improve sleep, reduce absenteeism, and improve quality of life. But there is a restriction, there are limitations. And very often, for example, for junior doctors, this is because the environments and the policies that they are kind of working around mean that they have limited control over their sleep. So the second kind of tier of intervention that's really important is to think about what's the environment and culture around sleep that you are supporting. Now, there are a number of different ways to support employees to sleep better. I would argue that you don't have to invest in an expensive napping pod, but having a conversation about your expectations, whether there is permission to use your lunch break to go and have a nap, for example, providing the right environment with plenty of natural light, thinking about what are your expectations for people coming into meetings, can you just have meetings over a set period during the day? Email response protocols. Some employers actually restrict the receiving and giving it emails overnight. So for example, from 10 p.m. until 6 a.m. Now that's not going to work in every workplace, but it's definitely an interesting conversation to have. And it's worth thinking that all the other workplace wellness initiatives that you have, whether that's a gym or subsidized healthy eating, that's also going to have a knock-on impact on your sleep of your employees. There's often a question about incentives. Does it work to try and pay people to sleep for longer? And there is some evidence that for some people that might be helpful. But if you have a sleep disorder, then actually that could potentially penalize you and make you more anxious about sleep. So I'm kind of on the fence about that one. Of course, for some employers, this kind of intervention is not really practical. I also do a lot of work with the military, and there actually it might be more around safety. Okay, so we know that we're going to restrict the sleep of our employees because of operational environment that they're in, but can we at least make sure that they're not driving home afterwards? In the Royal Marines, they've started to issue sleep masks to new recruits. That's following some work that we've done around prioritising sleep, and it just sends a message that sleep is important. They're also looking at investing in new mattresses and the sleep environment to make sure that while people are in a training environment, they get the most sleep that they can. And they also want to build up the capabilities, the train-the-trainer type approach, so that actually the personal training cadre across the military is capable of supporting people with their sleep, and they're treating sleep in the same way that they treat diet and exercise as core pillars of health. And sometimes that might mean using wearable devices as well. So First Beat is one example of a kind of tracker that you can use potentially to assess, for example, different shift patterns to see which suits people best. Finally, and I want to leave time for questions, I think the area around sleep disorders, for some employers, this sits more with a kind of NHS approach. For some, it's more a health and wellness choice. But I just want to make one point about sleep disorders, which is around insomnia, the most common sleep disorder, that the primary treatment is actually a behavioral treatment, cognitive behavioral therapy for insomnia. And in previous years, this wasn't widely available, but actually there are now digital programs for CBTI which are widely available. I used to work on one called Sleepio, but there are many. This was data from one study where we actually took 100 patients with anxiety or depression, and all they got was digital CBTI. And you can see that not only did their sleep pattern improve, but also it helped to address their mental health. Another study, just briefly, we looked at the outcomes of self-control and job satisfaction. Again, this was using digital CBTI, and you can see that for the sleep improvement group, we saw significant improvements. And finally, another study that you might be interested in was published by the Sleepio team. This is after I left, but they did an analysis where they followed up people who had used digital CBTI versus age and gender matched controls, and were able to show that there were healthcare savings from using CBTI to improve sleep. So hopefully this has helped to convince you that sleep is a tool that you can use to not just help save money, but also to improve the health, well-being and productivity of your teams. I will leave it there, and I hope we have a few minutes for questions. Thanks, Mark.
Sophie, that was fascinating. I don't think anyone could listen to that and not see some things that they can improve for themselves. I certainly can. And we have had a number of questions, which is always good because it means the audience is listening. So we're going to dive straight in if that's okay. And the first question we've had from here is from Nimisha, and she says, is it healthy if you sleep less during the week and try to make it up the weekend?
Oh, bad luck, Misha. So what happens when we do that is that we cause something called social jet lag. It's like we're pushing our body clocks forwards and backwards. So we adapt during the week, and then we delay things at the weekend, and come Monday morning, it's as if we've flown in from Tel Aviv. So it puts more pressure on the body, which over time can lead to increased risks of weight gain and potentially heart disease. So if you can get the sleep that you need during the working week, that's going to fare you better. If your only option is to catch up at weekends, it's still better to catch up than to miss out on that sleep entirely. So it's always a compromise.
Everything's a compromise, I guess. Something I was thinking when we're going through this, and Martin Nichols has asked a similar question. So I use a Garmin device, and it tracks my sleep. And it told me last night that I had 7 hours and 19 minutes of sleep, and it was fair. But it breaks it down into kind of 3 different areas. It's got awake, it's got light, awake, light, REM, and deep. Is there a kind of, I suppose, a sweet spot we should be aiming for between those different categories? What does good look like, I suppose?
Oh, I have a love-hate relationship with trackers. I've actually got a Whoop that I bought recently, and I wear a Garmin as well, and I've used an Oura Ring in the past. And what's really interesting is that they always give you different scores. So they are not 100% accurate. They're definitely getting better, but certainly don't read too much, particularly into those different sleep stages. The only way to really measure that is really to measure what's going on in the brain. But in answer to your question, we don't have a perfect recipe for a good night of sleep. It actually changes quite a lot depending on what you've done during the day, and also how your sleep was in the previous few nights. So if you're very sleep deprived, for example, you'll find that you get quite a lot of deep sleep. It sounds kind of good, and it is, but it's only because you've paid the price of sleep debt to up your deep sleep. So on average, usually a healthy adult will spend about 50% of their time in the lighter stages of sleep, maybe 25% of their time in REM sleep. A little bit of time awake, that's also totally normal, and a little bit less in deep sleep.
Right, really interesting. And I kind of have it. I look at it every morning to see how I feel, and you think, well, actually, does it chime with how I feel? But it's interesting to know that you use it as well. You use them as well, but you don't follow it kind of religiously.
I have met a lot of people who become quite anxious about them, and I think this is a really important question. If you're thinking, oh great, we're going to use wearables, we're going to do a study, we're going to evaluate our shift work patterns and see which ones work the best. Ethically, it's really important to consider there will be a lot of people that actually A, don't want to share their sleep data, and B, that actually focusing in on their sleep can make them more anxious. And there's a condition called orthosomnia, which is actually an obsession with the perfect night of sleep, which is often caused by using wearables. And people will actually get up in the middle of the night and look to see, what their sleep has been like. So the moment that you feel anxious about your sleep, take off the tracker and just use your perception to guide your behavior.
Brilliant. We've had a couple of questions on the next topic, which is perimenopausal phase and menopause. What's the impact during those phases on sleep?
It's not great, as anyone who is of that, who's affected will know. So men and women have quite different sleep patterns. There are definitely sex differences in sleep. As we saw from the chart earlier, men actually tend to sleep a little bit less, although the overall recommendation is that everybody needs 7 to 9 hours. When we hit puberty, pregnancy, and menopause, any time that there's massive fluctuations in the sex hormones, we tend to see sleep disruption. And some women actually have sleep disruption at certain times in their cycle as well, every month. But for the most part, I think the most important thing to take away is that good sleep hygiene and cognitive behavioral therapy for insomnia are still the most evidence-based interventions in terms of supporting people at that time. So even though they're not going to address the physical sort of symptoms, hot flushes, or in pregnancy, they're not going to change the fact that you've got a baby wriggling around disturbing your sleep. What they do change is the way that you respond to poor sleep. So rather than getting frustrated and anxious about not being able to sleep, TBTI is really just kind of learning to cope with it, to just deal with it and get on with life and not let sleep stop you from doing what you want to do.
I think we're coming to the end, but I have one more question that's popped up, which I think is quite interesting. So this is from April. It said, are there certain winding down routines and exercises that work better than others prior to going to sleep?
There are, but they'll be different for you and I, Mark. So what's really important is that you get yourself into a mindset which is calm, positive, and relaxed. And so for me, I might particularly love heavy metal. I don't actually necessarily recommend that, but whatever does it for you. If you grew up with your mum making you some warm milk or giving you chamomile tea and telling you that it was going to help you wind down, then it probably will help you wind down. There is a massive placebo effect in insomnia where if you believe something that works, it's probably going to work because it's going to ease that anxiety about not sleeping. And certainly in terms of a wind down routine, you want things that are going to lower your heart rate, lower your blood pressure, and get you into a relaxed state of mind before sleep.
That's brilliant. And quite sadly, it's 11:30. We've got to leave it there. We've had the most questions I think we've ever had. So we'll try and answer those after this. We are going to send a recording of this out because people have asked that as well. But I generally think this is the most questions that we've ever had during a webinar. So thank you so much for your time today. Thank you very much for coming in. Thank you very much for educating us all. Thank you all who have taken the time to attend this morning's webinar as well.